Okay, yes, let's talk about this. For those who don't know, endometriosis is a gynecological condition where basically a tissue in your uterus is in places outside of your uterus. Now, the severity and the location depends on the person. So some people have mild endometriosis and they don't have a lot of tissue outside. Some people have it everywhere, their bowels, their bladder. It impacts their ability to urinate without pain or have a bowel movement without pain. So it can be extremely serious. However, if we look at the origins of why we have endometriosis or why it develops, there are a few theories. One of the theories being a genetic component or a genetic link. Another theory looking at a autoimmune link. I think there's a little bit of both of those things. There is some research coming out specifically about different things we're exposed to in the womb. Hormone disrupting or endocrine disrupting chemicals can increase the risk. We look at diet. There is studies that talk about red meat, and those who consume more red meat, trans fat, and processed foods are more likely to develop endometriosis. Now, none of that matters when you already have endometriosis, but I'm just trying to give you an idea as to the background in how we can look at this from a holistic perspective. And so sometimes birth control is a really great option while we're figuring things out. And so when I'm working with my patients, I don't necessarily need them to get off of birth control right away. What we do is I call it laying the groundwork, building those foundations, and then coming out off of birth control and seeing how you are. So there's a lot of things we can do to alleviate or just make better your condition, depending on how bad it is, depending on where you're at. But going through diet, lifestyle, liver support, getting you on the right diet, looking at your microbiome, your gut health, food sensitivities, these all play a major role in just the general inflammation. And if we're looking at this from an autoimmune perspective, which we should when it comes to endometriosis, we're looking at how to control the immune system, right? You have an immune system that's almost attacking itself. And so that causes pain. And so coming back to diet and lifestyle, anti-inflammatory diets, getting rid of alcohol, red meat, processed foods. Now, it's not as easy as that. I know I'm saying eat anti-inflammatory and everything will be better. That's not what I'm saying. There is a time and a place for birth control, but there are also a lot of other tools we can use beyond birth control, including acupuncture, including bioidentical hormones, topical hormones, supplements, herbs, lots of different physical modalities. There's definitely lots to be done because I also hated birth control. And yeah,